Hello everyone. Today we are going to see about the basic introduction of one of the most lethal disorder. It's not only one of the most lethal disorder, it is the top most lethal disease, which is usually known as CHD. Coronary heart disease also it is called CHD, but it has other synonyms like ischemic heart disease. Ischemic means obstruction of blood flow. So let's see about it. So first definition, coronary heart disease is defined as impairment of heart function due to the impaired or inadequate supply of blood to heart, which means to heart there will be always some circulation will be there, which is called coronary circulation. This coronary circulation will be impaired, so that the heart won't get enough blood supply in order to maintain its function. Usually what heart will do, it will pump blood. To pump blood it needs blood which is provided by coronary circulation. So when there is a obstruction in the coronary blood vessels, or when the coronary circulation is impaired, this coronary heart disease occurs. So which means that the heart function will be impaired as a result of inadequate blood flow to the heart, so which will be resulting in lack of heart function or impaired heart function, which is called coronary heart disease or ischemic heart disease. So now you can understand that what is ischemic heart disease. So ischemic means lack of blood supply. So ischemic heart disease, lack of blood supply to the heart. So it means that blood is not enough supplied for the heart, so heart is not functioning good. So this is the definition of coronary heart disease. Now we will see about how lethal this disorder is. Coronary heart disease accounts for 20 to 30% of death all over the world. It means that in all over the world, if in a day 100 people are dying, means if 100 people are dying, in that 25 to 30 people would be dying for this disease, coronary heart disease, and the next one would be cancer. So the coronary heart disease is more lethal than cancer. So it is the first and topmost lethal disorder. Then the next is cancer, then there would be other diseases. So it is the most lethal form, which means if this disorder is there, you should be more precautious, and you should be under treatment. So it is most lethal, no? So if it is most lethal, the WHO will definitely take some action, and WHO considers this disease as a modern epidemic. So epidemic means you all know a disorder which affects millions of people all over the areas, like from Australia to USA, it affects all over the people. So it is called epidemic. So they are considering this coronary heart disease as modern epidemic. So modern epidemic means recently this disease is becoming epidemic. So that is called, it is a modern epidemic. So that much attention WHO has given. Next, coronary heart disease will manifest the following conditions. Like it can be manifested in one of the conditions, like angina pectoris. In angina pectoris, coronary heart disease might happen. Then in also myocardial infarction, and also cardiac failure, and also if cardiac rhythm is damaged, it is also a condition. Then in sudden death. So in all these conditions, coronary heart disease might manifest itself. So now we know that coronary heart disease is one of the major or one of the most lethal disorder. But how it is occurring, or why is it occurring to us? So let's see about the risk factors. The major risk factors would be, the first would be smoking. So smoking will definitely leads to many disorders, and in that coronary heart disease is one of the most lethal disorder. Then the second thing is hypertension. So hypertension means if your BP is high, you have a major risk of getting coronary heart disease. So if you have a little bit of high BP also, you should be under medication, and you should try to manage that. So this is one of the major risk factor for getting CHD. Then the third one would be diabetes mellitus. In diabetes mellitus patients also, there is an increased risk of getting CHD, and also hypercholesteremia, which means high cholesterol level. So if you have higher cholesterol, you should definitely be cautious about this disorder. So it is also one of the major risk factor. And also atherosclerosis patients, if you have atherosclerosis, it is also a major risk factor for this disease. And next, obesity. So obesity is also a major concern in CHD, because in obesity there will be more cholesterol. So the obese patients will definitely have hypercholesterolemia, and also they have an increased risk of getting diabetes mellitus also. So if these conditions, obesity, hypercholesterolemia, diabetes mellitus, everything is connected, there is more chance of getting a coronary heart disease. So if you have at least one of them, you can manage with something, but if you have 2-3 complications together, you have the most risk of getting this disease. Except these risk factors, there are few other risk factors, like drinking of alcohol is also a risk factor, and also genetic reasons. So CHD is also happens because of genetic reasons also, and also some hormones plays a important role, especially the patients with hyperestrogen levels will have a more risk of getting this disease. So if your estrogen level is high, you have higher chances of getting coronary heart disease. And apart from this, one major risk factor is there, physical inactivity. So if you are physically inactive, you are not doing any workout, or you are not doing any exercises, then you have more chances of getting this disease. So in order to reduce this disease, you should maintain some physical activity. So altogether, all these risk factors, when they are alone or when they are together, they tend to form this coronary heart disease. So now we know what are the risk factors. So let's see about what are the preventive measures for coronary heart disease. I mean, what can we do in order to prevent this disease? So let's see about that. You can easily predict, like you should avoid smoking, you should avoid drinking, you should be diet conscious, those things only. So the first thing is dietary changes. You should make a diet to not get anything related to hypercholesterolemia or obesity or diabetes mellitus or atherosclerosis. So these conditions can be prevented by maintaining your diet. So dietary change is one of the most important preventive measure for this disease. Next, the second preventive measure is stop smoking. So smoking is the major risk factor for this disease. So by stopping smoking, you can reduce most of the risk of getting this disease. Next, third thing is maintaining the blood pressure. So if you have high blood pressure, you should definitely be maintaining it. So thereby you can reduce the risk of getting coronary heart disease. And the fourth preventive measure is physical activity. So if you are physically inactive, you have a chance, you know that. So if you are maintaining a physical activity at least once in 2 days, or at least 3 days in a week, so like that you can maintain your physical activity. So by maintaining physical activity, we are keeping our heart healthy. So that means by maintaining physical activity, we are reducing the risk of getting coronary heart disease. And also there are few other preventive measures, like you should stop alcohol, and you should concentrate more on your health. So these things are there. So totally these are the preventive measures for coronary heart disease. So today overall we see about the basic introduction of coronary heart disease, and also how lethal this disorder is, and how it is causing, and what are the risk factors, and how can we prevent this disorder. So all these things we have seen. I hope you guys like this video, and if you understand this video very much, you can share it with your friends, because they also get benefited, as this disease is a major health concern in this population. And if you want to see these kind of videos, you can subscribe to this channel, and also press the bell icon in order to get notifications whenever I am uploading a new video. So I will see you guys in the next video. Until then, bye from Vasant.